At 14:17 on the afternoon of August 3rd, 1944, Lieutenant Commander James Franklin Morrison stood on the starboard deck of the USS Comfort, watching 37 Japanese prisoners of war climb aboard his ship. Morrison was 32 years old, a Navy medical officer from Cedar Rapids, Iowa, and the chief surgeon of the largest hospital ship in the Pacific Theater. The Comfort stretched 520 feet from bow to stern, her white hull gleaming in the tropical sun, massive red crosses painted on her sides visible for miles across the turquoise waters off Saipan. The prisoners moved slowly up the gangway, their uniforms hung in shreds, blood soaked through makeshift bandages. Several couldn't walk without support from Marine guards. Morrison counted 12 men with visible gunshot wounds, 9 with shrapnel injuries, 6 missing limbs, and 10 so malnourished their ribs showed through torn shirts like xylophone keys. The smell hit him first: infected flesh, untreated wounds festering in the Pacific heat, human waste, fear. Morrison had smelled death before, in field hospitals across 3 island campaigns. But this was different. These men had been dying slowly, forgotten in caves and foxholes, waiting for an end that wouldn't come. Behind Morrison stood 47 doctors, Army, Navy, a few civilian volunteers who'd signed up after Pearl Harbor. They wore white medical coats over khaki uniforms, stethoscopes hanging from their necks, surgical masks pushed down under their chins. They'd been briefed an hour earlier. Treat them exactly like American wounded. No exceptions. No different standards. The orders came from Admiral Nimitz himself, and the prisoners reached the main deck. They stopped, frozen, staring at the ship around them with eyes that couldn't process what they were seeing. The Comfort wasn't just a hospital. She was a floating miracle. 12 operating rooms, 400 beds with clean white sheets, X-ray machines, blood banks with Type O negatives stored in refrigerated compartments, electric lights, running water, flush toilets, a fully stocked pharmacy with morphine, sulfur drugs, plasma, anesthesia, antibiotics that hadn't existed 4 years earlier. The Japanese prisoners had never seen anything like this. Their own medical system had collapsed months ago. Japanese field hospitals were caves with dirt floors. Medical supplies consisted of sack for anesthesia, silk thread for sutures, rusted scalpels, and nothing else. And wounded Japanese soldiers received orders to commit suicide rather than burden their units. The concept of a dedicated hospital ship, unarmed, protected by international law, staffed by dozens of doctors, didn't exist in their military doctrine. One prisoner fell to his knees on the deck, a young soldier, maybe 19 years old, missing his right leg below the knee. The stump had been wrapped in a Japanese flag, the white fabric black with dried blood and infection. He looked up at Morrison with an expression the commander would remember for the rest of his life. Terror, confusion, and something else Morrison couldn't quite identify. They couldn't believe Americans would save them. "Get them to triage," Morrison said quietly. "Fast as possible. I want every man examined, wounds cleaned. IVS started within 30 minutes. The Japanese military had told these soldiers that Americans were demons, barbarians who tortured prisoners, monsters who would mutilate wounded enemies and leave them to die screaming. For 3 years of war, Japanese propaganda had hammered this message into every soldier's brain. Surrender means death. Capture means torture. Americans show no mercy. Now these prisoners stood on an American ship, surrounded by American doctors, waiting for the torture to begin. They had come expecting hell. They couldn't believe what happened next. The USS Comfort had been commissioned 11 months earlier, in March 1943, converted from a commercial passenger liner into the Navy's most advanced hospital ship. She'd sailed from San Francisco with a crew of 475 medical personnel. the largest concentration of surgical expertise in the Pacific Fleet. Her mission was simple: save American lives. Bring wounded Marines and soldiers back from the edge of death, keep them alive long enough to reach stateside hospitals. Lieutenant Commander Morrison had enlisted in the Navy Medical Corps in December 1941, 4 days after Pearl Harbor. He'd been a civilian surgeon in Iowa, running a small practice, treating farm injuries and delivering babies. The war changed everything. He'd completed officer training at Naval Station Great Lakes, gone through advanced combat medicine courses, and deployed to the Pacific in May 1943. He'd seen Tarawa. He'd operated through the Kwajalein invasion. So he'd spent 72 hours straight in surgery during the Saipan campaign, removing shrapnel from 19-year-old Marines while the ship rocked in 10-foot swells. He'd saved hundreds of American lives. He'd never treated an enemy soldier until August 3rd, 1944. The order had come down 3 days earlier from Pacific Fleet headquarters. Under the Geneva Conventions, enemy prisoners of war who were wounded or sick had the same rights to medical care as friendly forces. The United States would honor those conventions. Every captured Japanese soldier who needed medical attention would receive it. No exceptions, no delays, no different standards of care. The order sparked controversy. Some Navy personnel didn't want enemy soldiers on American hospital ships. These were the same enemy who'd attacked Pearl Harbor, who'd executed American prisoners on Bataan, who'd tortured captured pilots and beheaded surrendering Marines. The Japanese had committed atrocities across the Pacific, and now the U.S. military was supposed to save their lives. Morrison understood the anger. He'd seen what Japanese forces did to wounded Americans. He'd operated on Marines who'd been bayoneted multiple times after they'd already been shot and couldn't fight back. He'd treated pilots who'd been pulled from the ocean with evidence of torture. Fingers broken, burns from cigarettes, evidence of systematic brutality before they'd managed to escape. But Morrison was a doctor first. The Hippocratic Oath didn't include exceptions for enemy soldiers. It didn't say, do no harm unless the patient tried to kill your countrymen. It said, heal the sick, treat the wounded, save lives, period. The 47 doctors aboard the Comfort represented the best American military medicine had to offer. They'd trained at Johns Hopkins, Harvard Medical School, Columbia, Stanford, the University of Pennsylvania. They'd brought with them the most advanced medical knowledge in the world, surgical techniques developed in American universities, pharmaceutical innovations from American laboratories, equipment manufactured in American factories. American medical training had always emphasized one core principle: every patient deserves the best possible care. The Japanese medical system operated under completely different assumptions. Japanese military doctors served the emperor, not patients. Their primary mission was keeping soldiers combat effective, not preserving individual lives. The wounded soldiers who couldn't return to duty were expendable. Resources went to healthy troops who could fight, not dying men who couldn't. Japanese field hospitals had mortality rates above 60%, not because Japanese doctors were incompetent, but because their system allocated minimal resources to medical care. This philosophical difference meant Japanese soldiers had never experienced modern military medicine. They'd never seen what was possible when a nation committed massive resources to saving wounded troops. They'd never witnessed the American approach. Every life matters. Every soldier deserves maximum effort. Death is the enemy we fight as hard as we fight any human adversary. The 37 prisoners climbing aboard the Comfort on August 3rd had been captured during the final days of the Saipan campaign. The Marines had found them scattered in caves and jungle hiding spots, some unconscious from blood loss, others delirious with infection and fever. Standard procedure was emergency stabilization, then transport to the nearest hospital ship for treatment. The Marines who'd captured them had expected resistance. Japanese soldiers almost never surrendered, The Bushido Code demanded death before dishonor. Surrender means eternal shame, not just for the individual soldier, but for his entire family back in Japan. Most Japanese troops fought to the death or committed suicide when defeat became inevitable. These 37 had been too wounded to fight, too weak to kill themselves. They'd simply waited in the jungle for death to arrive naturally. They had never seen American medicine in action, because they couldn't believe they were about to experience it firsthand. The first prisoner entered triage at 14:33. Pharmacist's mate second class, Robert Chen, a Chinese-American medic from San Francisco, pointed the man toward examination table 3. The prisoner hesitated. His eyes darted around the compartment, taking in the bright electric lighting, the clean tile floors, the rolling instrument trays with sterilized surgical tools arranged in precise rows. Chen spoke to him in Japanese. "Sit down. We need to examine your wounds." The prisoner didn't move. He stared at Chen with an expression somewhere between terror and disbelief. His right arm hung useless at his side, the shoulder joint shattered by what looked like a .30 caliber round from an M1 Garand. The wound had been untreated for at least a week. Nan's infection had spread down the arm, turning the skin purple-black. Without immediate treatment, he'd lose the entire arm by morning. "Sit," Chen repeated. The prisoner sat. Slowly, like a man lowering himself onto broken glass. Morrison watched from the doorway. He'd seen this reaction before, but never this intense. Wounded American soldiers sometimes went into shock, became unresponsive, stared into space while corpsmen worked on them. Combat did that to men. The human brain could only process so much trauma before it shut down. But this was different. These Japanese prisoners weren't in medical shock. They were in ideological shock. Everything they'd been taught about Americans, everything they'd believed for years, was colliding with reality, and their minds couldn't reconcile the contradiction. Lieutenant Patricia Henderson, an Army nurse from Baltimore, approached the prisoner with a syringe of morphine. She was 28 years old, 5'3", with red hair pulled back in a tight bun under her nurse's cap. She'd volunteered for the Army Nurse Corps in 1942, completed combat medical training at Fort Sam Houston, and deployed to the Pacific in January 1944. She'd treated over 300 wounded soldiers in 7 months. The prisoner flinched when she touched his good arm. "Easy," Henderson said softly. "This is morphine. It'll help with the pain." She didn't know if he understood English. It didn't matter. Her tone carried the message. She injected the morphine, waited 15 seconds, then began cutting away the shredded remains of his uniform shirt. The infection was worse than it looked, and necrotic tissue spread from the shoulder wound down to the elbow. The arm radiated heat. Morrison could see it from 6 feet away, just by watching how Henderson pulled her hands back slightly after touching the skin. Fever this severe meant sepsis. Without antibiotics, the man would be dead in 48 hours. "Get him to OR 3, Morrison said. "We're taking the arm." Henderson nodded. 2 corpsmen lifted the prisoner onto a gurney. He didn't resist. The morphine was hitting now, and his eyes had gone distant and unfocused. As they wheeled him toward the operating rooms, Morrison saw him turn his head, looking back at the triage area where more prisoners were being examined. His lips moved. Morrison couldn't hear the words, but he recognized the shape they made in Japanese. "Tasukete kureta." They're helping us. The second prisoner had shrapnel embedded in his abdomen. The third had a fractured femur, the bone broken in 2 places, the leg bent at an impossible angle. The fourth was missing 3 fingers on his left hand, the stumps wrapped in a cloth that might have been white 3 weeks ago, but was now the color of old rust. 12 prisoners needed immediate surgery. 9 required IVs and antibiotics but could wait. 6 needed amputations. 10 were so malnourished they couldn't be operated on until their systems stabilized. Anesthesia would kill them in their current condition. Morrison assigned cases to his surgical teams. He'd brief them individually, walk them through each procedure, make sure everyone understood the standard, treat them exactly like American wounded. Some doctors struggled with that standard. Lieutenant Alan Foster, and a Navy surgeon from Boston, pulled Morrison aside near the blood storage lockers. "Sir, I'm not refusing the order. I'm just saying we have limited supplies. Plasma, antibiotics, morphine. If we use them on prisoners, we might not have enough for our own wounded when the next battle starts." Morrison looked at Foster for a long moment. "How long have you been aboard the Comfort, Lieutenant?" "6 months, sir." "And in those 6 months, have we ever run out of medical supplies?" "No, sir, but have we ever had to ration morphine or turn away wounded Americans because we didn't have enough resources?" "No, sir." "Then your concern is hypothetical." Morrison's voice stayed level, professional, but steel ran underneath the words. "Our supply chain is robust. We receive shipments every week. We have more medical resources than any military in human history. We will not let American wounded die because we treated enemy prisoners. Do you understand?" "Yes, sir." "Good. You're on OR-7. Japanese soldier with a sucking chest wound. I want him in surgery within 20 minutes. The German prisoners had never seen this level of medical commitment when they'd faced Allied forces in North Africa or Italy. Wehrmacht soldiers had heard stories from comrades who'd been captured. Tales of American field hospitals with clean beds and actual surgeons instead of field medics with morphine and prayers. Those stories had been hard to believe until they'd experienced it themselves. American medical care that genuinely tried to save enemy lives, even when those enemies had been trying to kill Americans hours earlier. But the Japanese prisoners had heard no such stories. Japanese military culture didn't include POW narratives. Soldiers who surrendered ceased to exist in official records, as their families were told they died honorably in combat. The few Japanese POWs who'd been captured earlier in the war had no way to communicate back to Japanese forces. There was no whisper network, no underground intelligence suggesting Americans might actually treat prisoners well. So when the Japanese prisoners aboard the Comfort saw American doctors moving efficiently from patient to patient, checking vitals, cleaning wounds, starting IVs, they couldn't believe what they were witnessing. At 15:22, Morrison entered OR-3 to supervise the shoulder amputation. The prisoner from examination table 3 lay unconscious on the operating table, to anesthesia administered through a mask covering his nose and mouth. Lieutenant Commander David Park, the ship's chief anesthesiologist, monitored vital signs on equipment that would have seemed like science fiction to Japanese military doctors. Electronic heart rate monitors, blood pressure cuffs with pressure gauges, oxygen saturation meters. Morrison scrubbed his hands in the adjacent washroom. Hot water, surgical soap, 3 full minutes of scrubbing up to his elbows, exactly the same protocol he'd follow for an American patient. He stepped back into OR-3, and a surgical nurse helped him into a sterile gown and gloves. The infection had spread further than Morrison had hoped. He'd need to take the arm off at the shoulder joint to ensure clean margins. It would be a difficult procedure, but doable. And the Comfort's operating rooms had everything he needed: proper lighting, sterilized instruments, sufficient space for a surgical team to work without crowding each other. "Scalpel," Morrison said. The nurse placed it in his hand. The blade gleamed under the surgical lights. Morrison made the first incision. For the next 90 minutes, he worked with the focused intensity that had saved dozens of American lives over the past year. He cut through infected tissue, cauterized bleeding vessels, separated the humerus from the shoulder socket, removed the necrotic arm, cleaned the wound cavity, sutured layers of muscle and skin, dressed the surgical site with sterile bandages soaked in antiseptic solution. When he finished, the prisoner had a chance. Not a guarantee. Sepsis might have already spread too far, but a real chance. With antibiotics, onto proper wound care, rest and nutrition, he might survive. Morrison had given an enemy soldier the same level of care he'd give to an American Marine. By 1700, all 12 emergency surgeries were underway. The Comfort's operating rooms hummed with activity. Surgical teams worked under bright lights, voices calm and professional, calling for instruments, reporting vital signs, making decisions that would determine whether these men lived or died. In triage, corpsmen continued examining the remaining prisoners. They couldn't believe how much equipment the Americans had. Stethoscopes for every medic, thermometers that gave readings in seconds, blood pressure cuffs, otoscopes for checking Rs, ophthalmoscopes for examining eyes. Diagnostic tools Japanese field medics had never even heard of, let alone used. Pharmacists Mate Chen moved from prisoner to prisoner, taking medical histories through translation. Most couldn't provide useful information. They didn't know what medications they'd received, if any, or when their wounds had occurred, or what treatment they'd gotten in Japanese field hospitals. Several didn't know their own blood types. The American military tracked that information religiously. Every soldier had dog tags with their blood type stamped in metal. Medical records followed troops from training to deployment. Blood banks maintained supplies of all major types. The system was designed to save lives through information and preparation. The Japanese system had no equivalent infrastructure. Soldiers were expected to die, not survive. Medical records were minimal. Blood transfusions were rare, and the entire philosophy was different. American medicine fought death with science and resources. Japanese medicine accepted death as an inevitable part of war. One prisoner, a young private with a bullet wound through his left thigh, asked Chen a question in halting Japanese. "Why are you doing this?" Chen paused. He'd been asked this before, and he'd never quite figured out how to answer in a way that would make sense to them. "Because you're wounded," he said finally, "and we're doctors." The prisoner shook his head. "But we are your enemy." "Right now," Chen said, "you're a patient." The prisoner stared at him with eyes that had never seen anything like this level of humanity from an opposing military force. His entire worldview was shattering in real time, and he had no framework to process what he was experiencing. They scattered across the medical compartments, 37 prisoners distributed among beds and surgical recovery areas, each one receiving care that exceeded anything they'd imagined possible from an enemy force. At 19:45, Morrison stood in the central corridor between operating rooms, reviewing surgical reports. 11 of the 12 emergency operations had gone well. One patient, a corporal with abdominal shrapnel wounds, had died on the table at 1833 when a piece of metal lodged near his heart had shifted during the procedure and punctured the left ventricle. The surgical team had tried for 17 minutes to repair the damage, but the man had lost too much blood too quickly. Morrison read the time of death on the report. The team had done everything right. Sometimes everything right wasn't enough. The other 11 were alive, now stable, resting in recovery rooms with their vital signs monitored every 15 minutes. Morrison walked to Recovery Room B, where 5 post-surgical patients lay in clean beds with white sheets, IVs dripping saline and antibiotics into their veins, bandages fresh and properly secured. A nurse checked each patient methodically, noting blood pressure, heart rate, temperature, respiratory rate on clipboards hanging from the foot of each bed. The prisoner from OR3, the shoulder amputation, was conscious. His eyes tracked Morrison as the doctor approached his bed. Morrison checked the chart. Blood pressure stable. Heart rate elevated but within acceptable range. Temperature 101.3 degrees Fahrenheit, down from 104.1 pre-surgery. The antibiotics were working. "How do you feel?" Morrison asked. The prisoner didn't respond. And maybe he didn't understand English. Maybe he understood but couldn't believe an American doctor was asking about his comfort level. Morrison made a note on the chart. Continue current antibiotic regimen. Monitor for signs of sepsis. Maintain IV fluids. Soft foods only when patient can tolerate. He moved to the next bed. A private with a shrapnel wound in his abdomen, now stitched closed with 47 surgical sutures. The kid couldn't be older than 20. He'd probably been conscripted straight out of secondary school, given 8 weeks of training, handed a rifle, and shipped to Saipan to die for the emperor. Instead, he was lying in an American hospital bed, being kept alive by American doctors using American medicine. Morrison wondered if the kid understood how impossible this was. How the entire weight of Japanese military doctrine said this moment couldn't exist. American demons didn't save enemy lives. American barbarians didn't perform 7-hour surgeries on wounded prisoners. American monsters didn't check on post-operative patients to make sure they were comfortable. But here they were. Lieutenant Henderson entered Recovery Room B carrying a tray of medications. She'd been on duty for 8 straight hours, and fatigue showed in the slight slump of her shoulders. But her hands stayed steady as she prepared injections of penicillin for each patient. "How are they doing?" she asked Morrison. "Better than expected. The amputee's fever is dropping. The abdominal case is showing good vital signs. No signs of internal bleeding." Henderson administered the penicillin shots efficiently, one patient after another. The prisoners watched her with expressions Morrison had learned to recognize. Disbelief mingled with something close to reverence. They couldn't believe a woman was treating them with such professional care. In the Japanese military, women didn't serve in combat medical roles. Nurses existed but worked primarily in rear-area hospitals in Japan, proper, not aboard ships or in field units. The concept of a female army officer with medical training, serving aboard a combat zone hospital ship, treating enemy wounded, it didn't exist in their worldview. Henderson had encountered this reaction before from Japanese prisoners. The first few times, it had bothered her, the way they stared, like she was some exotic creature instead of a trained professional. Now she just ignored it and focused on her job. "I'm starting the morphine rotation," she told Morrison. "The surgical patients get doses every 4 hours. The non-surgical cases get it as needed for pain management." Morrison nodded. "Good. Make sure it's documented. I want records showing these prisoners received the same pain management protocols as American wounded." By 2100, all 37 prisoners had been treated. 12 had undergone surgery. 9 had received IVs, antibiotics, and wound care. 6 had been fitted with temporary prosthetics or splints for broken bones. 10 had been started on high-calorie feeding programs to address severe malnutrition. Morrison gathered the medical staff in the main conference room for a debrief. 47 doctors, exhausted but professional, and sat in metal folding chairs while Morrison stood at the front near a chalkboard where someone had written the day's statistics. Japanese POW medical treatment, August 3rd, 1944. Patients treated, 37. Emergency surgeries, 12. Amputations, 6. Lives saved, 36. Deaths, 1. Surgical complications, 0. Protocol violations, 0. "You did excellent work today," Morrison said. "Every patient received care that met or exceeded our standard protocols. The one death was unavoidable. The cardiac puncture was an existing injury that presented during surgery. The team did everything possible." Lieutenant Foster raised his hand. "Sir, what happens to them now?" "They continue receiving medical care until they're stable enough for transfer to a POW camp. That could be days or weeks depending on their conditions. While they're aboard this ship, Their patients first, prisoners second. And if we encounter more Japanese wounded in future operations, same procedure. We treat them, we save their lives if we can. Morrison saw doubt on some faces, acceptance on others. A few doctors looked like they were still processing the philosophical implications of what they'd done today. "I know some of you struggled with this," Morrison continued. "I know it feels wrong to save the lives of men who were trying to kill Americans 24 hours ago, but we took an oath. That oath doesn't include asterisks or exceptions. We're doctors. We heal people. That's what we do." He paused, looking around the room. "And you want to know what else we do? We show the enemy what American values look like in action. Not propaganda, not rhetoric, actual behavior. We show them that Americans don't torture prisoners. We don't execute wounded soldiers. We don't let people die when we have the capability to save them. We show them that the Japanese military lied to them about who we are." Morrison gestured toward the door, beyond which 36 Japanese prisoners were sleeping in clean beds, their wounds dressed, their pain managed, their lives saved by the same people they'd been taught were inhuman monsters. Those men out there will remember this for the rest of their lives. They'll remember that Americans treated them like human beings when their own military left them to die in caves. Some of them will make it home after the war. Some will tell their families what happened here. And then maybe, just maybe, that changes something about how future generations of Japanese people think about Americans. The room was silent. Or maybe it doesn't, Morrison admitted. Maybe it changes nothing, but we still did the right thing. We still acted according to our principles. We still honored our oath, and that matters, whether it changes enemy minds or not. He dismissed the meeting at 21:30. The medical staff filed out, heading to their bunks for a few hours of sleep before the next shift began. Morrison walked back to Recovery Room B one more time. The lights had been dimmed for nighttime. 5 prisoners slept in their beds, breathing slowly, peacefully, alive because American doctors had refused to let them die. The amputee was awake. His eyes followed Morrison as the doctor checked his chart one final time. Morrison met his gaze. For a long moment, neither man moved. Then Morrison did something he'd never done with an enemy soldier before. He nodded, just a slight movement of his head. Acknowledgement, respect between one human being and another. The prisoner's eyes widened. He couldn't believe an American officer would show him that level of recognition. Morrison turned and walked out of Recovery Room B. Behind him, the prisoner stared at the ceiling, his mind struggling to process everything that had happened in the past 7 hours. They had never seen anything like this. Over the next 6 days, the USS Comfort continued treating the 37 Japanese prisoners. The 12 surgical patients recovered faster than expected, testaments to both American surgical skill and the power of modern antibiotics. By August 9th, 11 of them were stable enough to sit up, eat solid food, and move around with assistance. The amputee from OR3 made remarkable progress. His fever broke completely on August 5th. By August 7th, he was walking short distances with a crutch, learning to balance with one arm. Lieutenant Henderson worked with him daily on mobility exercises, and Morrison watched the prisoner's attitude shift from terrified confusion to something approaching cautious trust. The 9 prisoners who'd received non-surgical treatment were discharged to the recovery ward on August 6th, where they continued receiving antibiotics and wound care. Several gained 15 to 20 pounds in less than a week, the result of regular meals with actual nutritional content, something they hadn't experienced in months. The 6 amputees were fitted with basic prosthetics manufactured in the Comfort's machine shop. The ship's engineers could fabricate simple prosthetic limbs from aluminum and canvas, devices that wouldn't win design awards but would allow the prisoners to walk and perform basic tasks. Each fitting session drew crowds of Japanese prisoners who watched in silent amazement as American engineers custom-built artificial limbs for enemy soldiers. They couldn't believe Americans were putting this much effort into helping them. The 10 severely malnourished prisoners required the longest recovery period. Corpsmen fed them small portions every 3 hours, gradually increasing caloric intake as their digestive systems adjusted. By August 8th, all 10 had gained measurable weight and showed improved energy levels. The one death, the corporal who died during surgery on August 3rd, was handled according to military protocol. His body was prepared for burial at sea, wrapped in canvas, weighted with steel, and stored in the ship's morgue until a proper ceremony could be conducted. Morrison insisted the prisoner receive the same burial honors as an American sailor. A brief ceremony, a moment of silence, a flag-draped canvas shroud, even though that flag would be a captured Japanese battle flag instead of the stars and stripes. Some crew members objected. Why honor an enemy soldier who'd probably killed Americans before he was captured? Morrison's response was simple: because we're not barbarians. The ceremony took place on August 6th at sunrise. Morrison read a brief statement acknowledging the prisoner's service to his country and his death far from home in the American commitment to treating all casualties with dignity. The body was committed to the sea off Saipan, the same waters where the man had fought and where hundreds of his comrades had died. The surviving prisoners watched from the deck, hands at their sides, expressions unreadable. On August 9th, a Navy transport ship arrived to transfer the prisoners to a POW camp on Guam. The healthiest prisoners would travel immediately. The surgical cases would remain aboard the Comfort for another week until they were stable enough for transport. Morrison supervised the transfer personally. He shook hands with Lieutenant Foster, Lieutenant Henderson, and the other medical staff who'd treated the prisoners. "You did good work," he told them. "Oh, don't forget that." As the first group of prisoners prepared to board the transport ship, several turned back toward Morrison. One, a sergeant with a splinted leg, spoke in broken English. "Thank you. Good doctor." Morrison nodded. "Good luck." The prisoners climbed aboard the transport, and Morrison watched the ship pull away, carrying 21 enemy soldiers who'd expected to die in the jungle and instead had been saved by the same forces they'd been taught to hate. Back in Recovery Room B, the remaining surgical patients continued their recovery. The amputee from OR3 was scheduled for transfer on August 16th. Until then, he received daily physical therapy, regular meals, clean bandages, and professional medical care that exceeded anything he'd received from his own military. On the evening of August 13th, Morrison made his final rounds before the last transfer. He stopped at the amputee's bed. "You're healing well," Morrison said, knowing the man probably didn't understand. "You'll be transferred in 3 days. The POW camp has medical facilities. You'll continue treatment there." The prisoner stared at him for a long moment. Then he spoke in careful English. "Why you saved me?" Morrison considered the question. He'd been asked variations of it dozens of times over the past 10 days, by his own staff, by other prisoners, even by himself during quiet moments alone in his quarters. "Because that's what doctors do," he said finally. The prisoner shook his head slowly. "No, Japanese doctor, not save enemy. Let enemy die. You different." "Yes," Morrison agreed. "We're different." "Why?" Morrison pulled up a chair and sat down beside the bed. "Because we believe every life has value, even enemy lives, even when those enemies were trying to kill us yesterday. We believe that the moment you became a prisoner, the moment you stopped being able to fight, you became a patient instead of a threat. And patients deserve medical care. All patients." The prisoner absorbed this, his face working through complex emotions. Finally, he said, "I tell my family, after war, I tell them American doctor saved my life. I hope you get that chance Morrison said. On August 16th, the last 16 prisoners transferred to the POW camp on Guam. Morrison stood on deck watching the transport ship disappear over the horizon, carrying men who would spend the rest of the war in captivity, but who would live to see its end. 36 Japanese soldiers had boarded the USS Comfort expecting death or torture. 36 had received professional medical care that saved their lives. One had died despite the best efforts of American doctors, but even he had died under anesthesia on an operating table, surrounded by people trying desperately to save him, a far better death than bleeding out in a cave on Saipan. The numbers were small in the context of a global war. 37 prisoners out of millions of combatants. A footnote in the vast narrative of World War II. But to those 36 men, it was everything. The USS Comfort continued serving in the Pacific Theater until the end of the war, treating over 9,000 American wounded and 247 Japanese prisoners of war. Lieutenant Commander Morrison remained aboard until October 1945. That's when he returned to Cedar Rapids and resumed his civilian medical practice. He never spoke publicly about his experiences treating enemy prisoners, but former crew members remembered him as a doctor who'd insisted on one unbreakable principle: the Hippocratic Oath had no asterisks. Lieutenant Patricia Henderson served through the end of the war and remained in the Army Nurse Corps until 1952, eventually retiring with the rank of major. She married a fellow medical officer and raised 3 children, all of whom became doctors or nurses. Before her death in 1994, she told an interviewer that treating Japanese prisoners had been the most important work I did during the war, not because of who they were, but because of who we proved ourselves to be. The amputee from OR-3 survived the war. After Japan's surrender, he returned to Osaka, where he lived until 1998. In the 1980s, he wrote a memoir that included detailed descriptions of his treatment aboard the USS Comfort. The book became a minor bestseller in Japan, contributing to changing perceptions about American conduct during the war. Several other survivors from that group of 37 prisoners wrote similar accounts. Their testimonies documented American medical care that directly contradicted Japanese wartime propaganda. While the impact of these individual stories is difficult to measure, historians note that post-war Japanese attitudes toward Americans were more nuanced than simple victor-vanquished dynamics might predict. American military medicine continued evolving after World War II, building on the lessons learned aboard hospital ships like the Comfort. And the principle that Morrison championed, that wounded enemies deserve the same medical care as friendly forces, became codified in U.S. military doctrine and influenced the development of modern international humanitarian law. The 47 doctors who treated Japanese prisoners aboard the Comfort went on to distinguished careers in military and civilian medicine. None received special recognition for their work on August 3, 1944, because they'd simply followed existing protocols and honored their professional oaths. But they'd done something more important than earning medals. They'd demonstrated American values through actions, not words. They'd shown that American power could be tempered with humanity. They'd proved that even in the midst of total war, principles matter. The Japanese prisoners who climbed aboard the USS Comfort had never seen anything like American military medicine. Their disbelief transformed into something else over those days of recovery. Respect, gratitude, and a realization that the world was far more complex than their military had told them. And they would never forget the American doctors who'd refused to let them die.